Hi, I'm Dr. Nilam Khurana again, and I wanted to talk to you a little bit about the potty training today since I mentioned it last time. The potty training is an interesting thing. This is my personal opinion, so it's not necessarily what organizations recommend or anything like that, but over the years what I've seen with potty training is that if done right, they can potty train early. It is totally fine to potty train them at 2 years. There's no need to wait until 3, which is where a lot of people say they should wait. But more of it has to do with their current developmental state. So if at 2, they're understanding so much and they're watching you when they go to the bathroom and you show them a potty and let them sit on the potty and they're interested and they want to do these things, then you show them. If they're not developmentally ready or they don't have the patience to sit for long enough, you don't. So that's the first key factor. So some kids can't do the potty training until they're a little bit older because they just need to be interested in it, and it can't be something that's forced upon them. If it's something that's forced upon them, lots of complications can happen, one of which is a stool holding behavior. And that's basically when, if they don't really want to sit that long on the potty, and even with pee, if they don't want to sit that long and you're making them go into undies and you're making them say, okay, we're going to sit on the potty and you're going to get a reward, well, they'll just be like, I'm just going to hold it. And then they're more likely to have accidents with their pee, and they're more likely to have constipation with their poop. So if they do have any of those things, what I usually recommend is going back, right? Which nobody ever wants to do because you've made success in your mind, right? But you haven't made success if they're struggling with it. So you want to go back to the basics for where they're comfortable. If they feel like they have to hide to go poop, if they're pooping in their pants, if they are pooping very hard poops and really just not pooping often enough, sometimes they can be holding their poop, and that's the real problem. And so giving them that comfort. So your stomach has all these nerves, and your nerves don't really tell you specifically what they are. We learn through our behaviors and time and cause and effect, right? So if you're hungry and you eat, that stomach pain that you had when you were hungry goes away when you eat. You learn that. If you are full of poop and you gotta go poop and you empty, you realize a relief of the stomach pain when you poop. But if they're not realizing that, then all they get is this general ow. And if you're uncomfortable, you're not gonna relax. So you have to relax that sphincter to be able to release the poop. So they're uncomfortable, they don't relax. Most of the time they tighten even more. And then it becomes more of holding that poop. And then that poop gets the water that's in there gets reabsorbed into the body. And they continue to have harder poops, which then makes the poop hurt, which then they remember the pain from the poop coming out hard, and sometimes they get tears. And then they don't want to poop from that, so then they get even more anxiety and more likely to hold their poop. So lots of layers of issues that come along if they are not trained at their right developmental stage, and if they're just physically not ready to sit still for that long. Every child has a different temperament. Some kids are really wanting to watch and mimic and go, and some kids are happy enough to go poop in their pants and just keep playing and not even care, and that's fine as long as we're working with them at their developmental age to make sure that they can reach their milestones. So potty training is a lot more complicated, and some parents are very eager to get it done early. So that's just kind of the one thing I want you to keep in mind is getting it done right is better than getting it done early, because you may end up having problems where you have to go backwards, and then it frustrates you more, and sometimes frustrates the child too, because then they get very anxious with it. So, but by 3, poop and pee potty training should be done. And when we say potty training, we mean they should be able to go to the bathroom, wipe themselves, flush the toilet, all that other stuff. They're not gonna be great with wiping the poop, but they should be learning to do that too. So when we say potty training, we're talking about all those things, not just actually getting the poop in the potty or actually getting the pee in the potty. It's knowing all the other things. They should be able to now, turn the sink on and off, wash their hands and all of that. That's typically not a developmental milestone until about 30 to 36 months. So again, if your child is able to do all of that earlier and they're interested in doing that because there's a range of development, then that's fine. But keep in mind that we want them to be able to have those self-help skills And when they're able to do those self-help skills is when they're developmentally ready. So they have to have the patience to sit, they have to have the interest to learn to poop, and then they have to have the basic foundation of self-help skills to be able to wash their hands without needing help. If they can do that, then they're going to be able to learn all the other things. So just a couple of things to keep in mind with potty training, and hope that helped. Thanks for listening. Okay, bye.